Assalamualaikum to our lecturer, Dr. Nur Azura binti Ahmad. My name is Muhammad Ismail bin Irazak and my partner name is Fatika Hadawiyah binti Fauzi. We are going to present about the modeling the effect of consultation time toward patient waiting time at Pusat Kesihatan Universiti UM. As our background, the purpose of this audit is to assess patient waiting time and doctor consultation time in a Pusat Kesihatan Universiti UM and to formulate strategies for improvement. All patients who attend the clinic during this period was included in the study except for those who are required more time to be seen, such as those who were critically ill, aggressive, and those who come for repeat medication or procedure only without needing to see the doctor. Next, the problem statement. Waiting time as well as consultation time are the main factor that affect patient and consumer satisfaction. Patients are aware that they should wait to see a doctor. However, there is no known acceptable waiting or consultation time. Evidence show that patients are less likely to be dissatisfied if their waiting time is within 30 minutes. A long and complicated registration or work process with unnecessary duplication of tests can prolong waiting time in PKU-UM. As our research question, we have three. First, what is the effect of consultation time toward patient waiting time at PKU-UM? Second, why the waiting time become issue to the patient? And third, how to reduce the length of waiting time at PKU-UM? Next, our research objective to identify the effect of consultation time toward patient waiting time at Pusat Kesihatan Universiti UM, and the second, to study the length of consultation between the patient and the doctor, and third, to study the waiting time at Pusat Kesihatan Universiti UM. For the scope of the research, the study are focused on modeling the effect of consultation time toward patient waiting time at Pusat Kesihatan Universiti UM among the student, staff, and public that using the PKU. For the significance of the study, the importance of the study is the presence of helpful and friendly staff is important to improve the waiting time. The availability of entertainment such as television, health information, and reading material may also improve the waiting experience. Also from the study can also know the satisfaction of service towards patient at Pusat Kesihatan Universiti UM. The study implication, Pusat Kesihatan University needs to improve in waiting time and to make the recommended changes to improve in service to patient. Need to conduct further research to assess patient satisfaction on the clinic service, including identification of student needs and to improve the quality of waiting by having distraction and facilities for patient comfort. Next literature review. Arifin, Azrai, and Kamaruddin at 2017 state that if waiting time is within 30 minutes, patients are less likely to be unhappy. Assess patient waiting time and doctor consultation time is a primary healthcare clinic and to formulate strategies for improvement. Ibn Hussein, Dibaks, Hassan, and Jaradat at 2017 also state that healthcare facilities require continuous development and improvement to enhance performance and achieve better utilization of resources. Various models and techniques have been developed and analyzed to determine the optimal solution of various healthcare system problems. Wikrama at 2017, customer desire short waiting time whereas service provider want to maximize resource utilization. It is revealed that the rule while record the lowest waiting time is not feasible due to high portion of server idle time. Takayakon and Ying 2017, many hospitals are currently paying more attention to patient satisfaction since it is an important service quality index. Analyzing and modifying whole process allow us to consider far more detail and provide more reliable result. For the methodology, description of the case study, majority of the patient at the Pusat Kesihatan Universiti is the students, so if they need to wait for a long period, it will disturb their class hour. The experience while waiting can also affect patient satisfaction and is influenced by other factors such as the condition and attractiveness of the waiting area. A long and complicated registration of work process with unnecessary duplication of tests can prolong waiting time in PKU-UM. These are the process flowchart, waiting time and consultation of the patient. This the process flowchart. Data collection and distribution fitting. Data collection of the study, the researcher used two types of data, which is primary and secondary. Data will be used to build the model, the effect of consultation time toward patient waiting time at PKU-UM. By having the primary data, the consultation time towards patient waiting time can be observed and recorded. For the secondary data, the data will be collected by approaches the related parties, which is PKU, in order to gather the information about the consultation toward patient waiting time. So, to reduce the waiting time, we suggest that PKU should add the number of doctor and reduce the consultation time. Okay. So this is the arena simulation. We run it. We run at the this is the 8 o'clock until 4 p.m. Run it for the 5 replication line. The patient will go to the registration and then go to doctor's room. After they see for the treatment, they will go to the pharmacy and exit the system. Summary of 5 replication. Thank you.
My name is Fatika Daya binti Fauzi. Next, I would like to continue result and analysis. Next, result and analysis. The collected data were inserted into the arena input analyzer to determine the appropriate distribution. As you can see, this is the table 1. Okay, next, validation carried out by test of mean absolute percentage error MAPE. The actual system showed that the release volume of patient is 85 patient while the model is 84 patient. The value of MAPE for this research is 1.18, which proves that the model is accurate using this formula. Verifying. Implement what if analysis is important to improve the system performance. Scenario 1. Add the number of doctors to decrease the patient waiting time. Table 2 shows that the overall result of the system performance between the base case and the scenario. Base case, 5 doctors provided for the system, total 105 patients that entered the system, 21 patients left the checkout system without the treatment because the waiting time is too long. Results show that average that patients spend for waiting time is 147.35 minutes. The average number of waiting time is 0.000932 minutes. The average number busy is 0. And the utilization of checkout 1, checkout 2, checkout 3, checkout 4, checkout 5 is 0.18548. For scenario, 6 doctors are provided for the system. Total 85 patients that enter the system. 21 patients left the checkout system without the treatment because the waiting time is too long. Results show that the average that patients spend for waiting time is 137.55 minutes. The average number of waiting time is 0.00746 minutes. The average number busy is 0 and the utilization for checkout 1, checkout 2, checkout 3, checkout 4, checkout 5, checkout 6 is 0.18045. And for the conclusion, that conclude that the scenario was found to be the best strategy to be proposed. If the PKU implement this scenario, the waiting time will be decreased from the actual system. From the system, just by adding one more doctor can help to reduce the average waiting time and reduce the number of waiting. That's all from us. Thank you.